My guest at this time is Dr. Marty Makary. He is a surgeon and a professor of health policy at Johns Hopkins University in Baltimore. He's also a New York Times best-selling author. His brand new book is entitled The Price We Pay: What Broke American Healthcare and How to Fix It. The book examines the maddening ways the healthcare industry overtreats and overbills us, and most importantly, how to get medicine back to what it is supposed to be. And Dr. Makary, thanks so much for being with us.
Great to be with you, Greg.
You describe a scene early in the book where you were driving by the U.S. Capitol when Congress was in the middle of a health care debate, and you wish lawmakers understood what was really wrong with the system, or at least how it got in the shape that it is now. And you document in detail in many different parts of this book how doctors are ordering unnecessary treatment for patients, and doctors and hospitals can literally charge whatever they want without disclosing the costs ahead of time. So how did we get here? I know that's a really long answer, but real quickly, how did we get to the point where it's more of a business than caring for the people?
Well, it was quite a moment when I did drive by the Congress Capitol building, and they were debating how to pay for health care. And I was going to a place where they were doing way too many health screenings that were not indicated, and people were getting unnecessary downstream tests because these doctors were doing too much screening and violating the screening guidelines. And it really made me think. Politicians talk about different ways to finance the broken healthcare system. We need to talk about how to fix the broken healthcare system. And the story that nobody's talking about, that we need to talk about, is the problem of inappropriate care and the money games of medicine. And those two problems single-handedly account for much of these price increases that we see at so many levels in healthcare. And it's really crushing everyday Americans. People are angry. They're getting hammered. And I think they have a right to be angry. Folks are getting crushed with these surprise bills, marked up bills. I mean, it's bordering on just outright price gouging of people at a time when they're vulnerable. They come to us doctors for help when they're vulnerable. And for them to be gouged like this, it's un-American. And I am trying to rebuild the public trust through a lot of our efforts now with restoringmedicine.org and the message of this book. We need to restore the public trust in the medical profession.
And I know a lot of people are happy about that, including many of the people in your book. I know from reading just the chapter on Carlsbad, as well as other parts of the book, of course, where just person after person you ran into, as soon as you mentioned why you were in town, everybody had a horror story about how they were overbilled and then how they were sued by the hospital, and so many lives made miserable, and in some cases destitute because of it. Let's take these one at a time, though, and I don't know if this is the simpler one, but let's start here. Why are we seeing so much overtreatment? Are many doctors just mistaken that unnecessary procedures are actually necessary? Is there too much of a profit motive here? What do you think is behind that?
Well, in a research study that my team at Johns Hopkins led, we asked 2,100 physicians across the United States what percent of medical care is unnecessary. They said 21%. They said 25% of the testing that we do and 22% of the meds that we give out. I mean, after all, don't we have this pill-popping culture that is just completely gone awry? We have the medicalization of ordinary life. We have the opioid crisis is really just one manifestation of overprescribing. That was just one medication. And so we asked the doctors, why do we have so much overtreatment? And they said, number one, there's a consumerist culture. People are coming in demanding things like antibiotics for their kid with a viral infection, or they're demanding an MRI. And we got to get rid of that. The second thing they said is a fear of malpractice. And finally, the big one they identified was this fee-for-service system, this crazy system where we pay for more for quantity, but we don't pay for quality. We just pay doctors for the more that they do, and guess what? They don't even like it. They don't like being paid this way, and this billing throughput treadmill that people are on as physicians, there's a rejection of it and a new movement now to restore medicine back to its mission by talking about food as medicine and spending time with people and lump sum payments, either from Medicare, so the patients don't have any expense, or from an employer. direct primary care. These clinics are doing amazing things, and I was privileged to profile them in the book. They are talking about treating diabetes with cooking classes and managing back pain with physical therapy and ice rather than just surgery and opioids. And this is the movement now to provide true holistic relationship-based medicine. And it's an awesome movement in American medicine that's alive and well.
There's a lot in the book. I believe it's the Improving Wisely program that you and your team have put together here and encouraged folks in so many different ways. So let's talk a little bit more about the negative before we get into a lot of the positive here. Many doctors in the book seem horrified by how much the patients are charged. Not all. If anyone reads The Price We Pay, I encourage them to pay attention to the doctor dinner part, for example. Not exactly the best exemplar of our healthcare system. But how has the system gotten so bloated that doctors don't know how much patients are being charged? Insurers don't necessarily know all the time what hospitals and other billers are doing here. How do we get everybody on the same page?
Well, Greg, I truly believe that we have great people in healthcare, doctors, nurses, everyone that works at the hospital, and our leaders, the heads of hospitals, are great people. But we are good people working in a bad system. We have inherited this crazy game of marking up prices for the purposes of select and secret insurance discounting. And that game is a crazy game, and it's resulting in this mass price inflation for the poor folks who are out of network or who don't have insurance or have had a lapse in insurance. They've done nothing wrong. These are everyday hardworking Americans who work at Walmart or in the postal office, we found. They come in, they're told that their insurance doesn't cover something, and then they're given this massive price. And when they can't pay it, a small fraction of hospitals that we identified aggressively sues them and garnishes their paychecks. And to me, this is the ultimate despicable violation of the great public trust in American medicine. And these sort of money games now, the price gouging, let's just call it what it is, price gouging of patients when they come in sick and vulnerable. And they're told to sign these financial documents. I give people tools in the book on what they should and shouldn't sign and what they should modify and how to navigate the system and look up prices on these websites like fairhealth.org and other websites. And you can get a fair price for your service if you know a little secret that not many people know, and that is that prices are highly negotiable before, during, and after the care. You just need to know what to ask.
It's interesting. I just want to follow up on the point you just made about when you sign the papers when you're admitted to the ER or the hospital. And first of all, you consent to treatment. And then the other thing they have you sign, sometimes with the same signature, is I'll pay whatever insurance doesn't cover. And you've advised folks to actually cross that out. Will the hospital still treat you if you don't consent to that? How does that usually work?
When we get downstream with a patient and are defending them for an egregious medical bill, we will often tell the judge in the courthouse where I will often be their free pro bono expert, and I'll tell the judge, Your Honor, I can't show up and mow your lawn and send you a bill for $4,000 without a contract. There needs to be an agreement. America is a civil society. These patients were never given a price, and a hospital that doesn't show prices for common elective non-urgent services, they have no right to gouge a patient, ruin their credit score, or even take them to court to garnish their wages. We win in court 100% of the time. We've asked hospitals to stop suing patients. One hospital that sued 25,000 people agreed to stop suing patients after me and my students went there. I tell the story in the book. But people need to know their rights. And when you are told, hey, you've got to sign this document in the emergency room, you don't have to sign any financial documents for emergencies or urgent conditions. You don't need to do any of that. You can agree to be treated. That's a separate document. But don't sign anything that says you financially sign your life away. The law requires hospitals to take care of any emergent condition or urgent condition in the emergency room. So if you can't cross it out because it's on an iPad, just sign did not read in the signature line, kind of with sloppy handwriting. But when the collectors call or you get sued to have your wages garnished, you tell them, show me the contract where I agreed to pay this because I was vulnerable. I came to a hospital when I was sick. Hospitals were designed to be a safe haven, a refuge for the sick and injured. Many were built by churches. We need to restore that great public trust in American hospitals.
We're talking with Dr. Marty Makary of Johns Hopkins University. The book is The Price We Pay, and as promised, we're on to the good stuff now. Dr. Makary, let's talk about your work just informing doctors where they stand in terms of how often they order something and comparing that with how often their peers do. How does that information motivate them to be a little more cautious in pursuing different interventions?
Well, Greg, first of all, I love being a doctor. Okay, it's the best job in the world, and to have somebody hug you after surgery and say thank you, there's no other job like that. Most doctors do the right thing or always try to. Most doctors, okay? But some fraction are responding to these perverse incentives where they can make millions by just overdoing things, especially when those things have no real high risk to it. They're safe procedures, and they're massively overdoing it sometimes. What we have done through our improvingwisely.org program is show doctors where they stand relative to their peers. Let's show you, as a, say, breast surgeon, how many opioids you're prescribing after lumpectomies compared to your peers for narcotic-naive patients, that is, patients who are not on opioids prior. And if you're at 20 or 30, guess what? You're doing too much. Let's show outliers that they're outliers with data. We do it confidentially with a Dear Doctor letter. And guess what? We've seen that 83% of doctor outliers reduce their pattern of overuse. And that program in just one area has saved $27 million. And I'm sure a lot of preventable harm. So we can do a lot, I think, in healthcare by appealing to the best in people. You know, we all go into medicine out of a sense of compassion. Even hospital administrators and insurance executives, everyone wants to be a part of healthcare for the public good. We just now have to restore medicine back to its mission, cut through these money games, and appeal to the best in people when we talk about avoidable, unnecessary medical care.
Then on to cost, price transparency. You talked before, especially if it's an elective procedure, that cost ought to be known up front. In most cases right now, it is not. How much of a difference would that make? And is there anything stopping providers from doing that?
There's a revolution right now to make prices visible. There's movement towards an open market. Just look at these websites like mdsave.com. One hospital clerk told me when I said, how much is a CAT scan at your hospital? She said, well, it's about $5,000. But if you go on this website, mdsave.com, our hospital sells that service for $500. So we're starting to see competition. Places like Surgery Center of Oklahoma and these other disruptors that are changing the market and are also really useful tools for people when they need stuff done. Look, Greg, if airlines billed us after the flights, travel sites had no prices, guess what? They would be gouging us all over the place. Now, I'm sure they could tell us, we can't give you a price. We don't know if the flight will be delayed or might have to make a diversion stop. We can't price that in. Heck, we don't know if you're going to consume a beverage on the airplane. But guess what? They have built in the risk into the prices. They have the variability built into that price. And when you go on a travel site, you get a fair, honest price. That is a coherent market, and prices on travel sites have been stable for 4 decades. Healthcare, there's no prices, and it's only a small fraction of healthcare that has had stable prices and transparent prices. Cosmetic surgery, IVF, LASIK eye surgery. And guess what? In that small segment of healthcare, prices have come down over time, where the rest of medicine has gone up.
What are the biggest obstacles for this becoming mainstream? Is it hospitals in some cases or other administrators who aren't dealing face-to-face with patients? Or is there a way to in the fairly near future make this the norm rather than the exception?
Well, I loved the movie The Big Short, if you've ever seen that movie, because it created mass literacy around the banking industry. And in this book, The Price We Pay, I tried to do the same with healthcare. Let's create mass healthcare literacy so people know what to ask, how to shop, where to go, where employers can send their business, how they can structure their benefits better, where you can get cheaper medications. And if enough people ask, we see markets move. Look, when we wanted nutrition labels on food, the industry told us we could never do this. They said, food prices will go way up, and they just simply cannot put nutrition labels on food. Guess what? Enough people demanded it, enough people asked, and we got it. And now companies boast on their nutrition ingredients, and competition is at the level of honest and fair value in the marketplace. That's what we need in healthcare. That's the revolution, and that's what I was privileged to be able to profile regarding the many disruptors who are moving this market right now nationally. And it's very exciting.
Can't recommend the book enough. Last 30 seconds, let's get full circle here and back to Congress. Is there any role for lawmakers at any level of government in helping patients here?
There's a lot of things we're asking Congress to do. Address surprise medical bills. If you've seen a mass flurry of commercials now against it, funneled by dark money from Wall Street and other organizations. We need honest legislation on surprise billing. We need more transparency with those secret negotiated prices between insurance companies and hospitals. That's a crazy old system, and the time has come for full transparency. There's no place out there where an industry has gone transparent and then said, this is a bad idea. Let's go back to keeping things secret. So there's a lot we need to do, but, I'm not relying on the government to fix healthcare. The private sector is doing an incredible job right now. Sure, we need to fight for things in government, but turn off cable news and let's stop talking about this artificial pro-anti, red-blue, we're a divided country argument. Turn off cable news. Those are arguments meant to divide us. I believe there's broad consensus in America on healthcare. We just have to explain the system. And if we can get rid of secret pricing, if we can get rid of kickbacks, and we can get rid of a disproportionate role of special interests, I think there's broad consensus in the United States on how we fix this thing.
Dr. Makary, I know firsthand the lives you've impacted due to your skills as a surgeon, the number of people whose lives you can improve due to the literacy effort you're making on the healthcare front, and the ideas that are being advocated in this book could make a huge difference in millions of lives. Thank you very much for the book, and thank you very much for your time today. We appreciate it.
Great to be with you, Greg.
Dr. Marty Makary, surgeon and professor of health policy at Johns Hopkins University in Baltimore. The new book is The Price We Pay, What Broke American Healthcare and How to Fix It. I'm Greg Corombos reporting for Radio America.